have a baby boy, they're faced with the decision of whether or not to circumcise the baby. Parents consider a number of factors, including cultural and religious traditions, the circumcision status of the father, health benefits of circumcision, and risks of the procedure. Circumcision rates have actually declined over the past few decades in the United States, so it's not an automatic that every baby boy will be circumcised. There are a lot of voices for and against circumcision, and sometimes parents can feel confused. At the C.S. Mott Children's Hospital National Poll on Children's Health, we wanted to find out from a national sample of parents how they look to their healthcare provider for advice and guidance related to circumcision. What we heard from parents is that most prefer to get information about circumcision prior to the baby's birth, and also most prefer to get information from the child's healthcare provider as opposed to the mother's obstetric provider. That can set families up for a little bit of difficulty because many parents don't know that they can get a prenatal appointment with the child's pediatrician or family doctor. Parents also noted that the healthcare provider was the most trustworthy source of information, ahead of organizations such as the American Academy of Pediatrics or the CDC, ahead of family and friends, and far ahead of internet searches. Parents expressed some clear preferences about how they want healthcare providers to interact with them around circumcision. For example, 9 out of 10 parents think the healthcare provider definitely should answer their questions about circumcision, and most believe the healthcare provider should provide scientific information. However, over 40% feel the healthcare provider should not recommend a specific decision around circumcision. In fact, 1 in 5 parents in this poll felt that circumcision is a family decision and healthcare providers should just stay out of it. This is a little different from what we might ordinarily see in terms of interactions between patients and healthcare providers, where the provider is more of an expert. So in essence, what parents want healthcare providers to do is serve as a sounding board about circumcision, rather than to give them a directive. For providers, this may feel slightly different than a typical patient interaction, where the provider is clearly the expert on the medical subject. This may mean that providers need to take a different approach to the discussion, allowing parents to take the lead and being there to answer their questions in a neutral way. Welcoming a new baby is an exciting, hectic, and somewhat anxious time for parents. Parents in our poll indicate that healthcare providers can be most supportive and helpful to them by being an unbiased source of information about circumcision and answering their questions, not by pushing a particular decision.